So, hi everybody. We are continuing with the last part of the urinary system, which is basically going to focus on the bladder, urethra, as well as some of the medical conditions associated with the system. So this picture is representing the reproductive and the urinary system when compared male and female. So a couple of notations for this. Here is the bladder for both male and female. For female, you notice that sitting right on top of that, you have the reproductive organ uterus or womb, which is basically where the baby grows in. The extension coming off of your bladder would be urethra. And in this case, the urethra in male, as you can see in the picture, is much longer. And the other difference is the location or the position of the prostate gland right underneath the urinary bladder in case of males. So when you look at the prostate gland, which is basically this yellow structure you see right here, you notice that it's surrounding the urethra. So normal condition, bladder, urine exits the urethra easily when the prostate is normal size. As males start to age, so about 50% of males between age of 51 and 60, they start to have what we identified as enlarged prostate. So the prostate would become something similar to this. So that causes the narrowing of the urethra and makes it very difficult for the bladder to empty itself. A lot of times, enlarged prostate can also be a sign of prostate cancer, which is not treated in some cases, can also cause or lead to urinary bladder cancer. Now, the next structure in the path, which is the last part of the urinary system, is the urethra. Urethra still have epithelium, but you can see that the epithelium is different as you go through the length of the urethra. You start with what we identified as transitional epithelium, what we discussed, very similar to ureter. Then they become a combination of stratified and pseudostratified columnar cells, somewhere in the middle of the urethra. Pseudostratified means basically fake stratified, as it appears to have multiple layers, but it's only one single layer. Now, the urethra closest to the exit from the body is actually made up of a stratified squamous epithelium with the goal of protection as it opens up to the outside. The urethra endpoint, when it opens up to the outside, is made up of two sphincters. These sphincters, one is internal and the other one is external. Internal is actually made up of a smooth muscle, which basically keeps the urine in place. External one is the voluntary muscle, which basically means it's a skeletal muscle, and it basically inhibits you from urination. That's the one that you basically control to decide when you want to urinate or pee. As I showed you in the earlier picture, the length of the urethra in male and female are different. So this is what I was depicting for you here. Females much shorter compared to the male, as the male need to go through the length of the penis, therefore causing it to be longer. So female urethra is about 3 to 4 centimeters, which is less than 2 inches, versus male could be up to 20 centimeters. Male urethra actually broken down to 3 segments. Prostatic urethra, which is self-explanatory. That's the part that is passing through the prostate gland. There is a diaphragm called the urogenital diaphragm, where the urethra passes through that. Urethra is referred to as membranous urethra. And the last part, as it passes through the length of the penis, is referred to as a spongy or penile urethra. So looking back at this picture, Again, this part of the urethra is called the prostatic urethra. This is the urogenital membrane, so that would be the membranous urethra, and the length of the penis would be the prostatic urethra, so the spongy or penile urethra. As I mentioned, we're going to look at some of the medical conditions in terms of the urinary system. One of the most common ones you hear is urinary tract infection, which is better known as UTI. It is an infection caused by bacteria, and it's more common in females for two reasons. One, shorter urethra allows for the bacteria to gain easy access to the bladder because they don't need to travel a long distance. And the second reason is the proximity of the orifice or entrance to the anal canal. So the bacteria from the fecal matters can gain access to the urethra and urinary bladder through that opening, through that proximity. The typical diagnosis is a urine sample, where if your urine sample is typically cloudy, they can diagnose you with, easiest way to say that you have UTI, but there's additional testing that can be done on the urine, for instance, culturing the bacterial sample to find the best antibiotics to deal with the infection. Symptoms are typically burning sensation when urinating, frequency of urination even if the bladder is empty, and maybe localized pain depending on the extent of the infection. Again, because this is a bacterial infection, the best way to treat it would be antibiotics. A lot of individuals recommend cranberry or cranberry supplements because cranberry does include an active ingredient that make it harder for the bacteria to stick to the wall of the urinary bladder. Basically, it washes them away. So it is a good idea to supplement with cranberry, not cranberry juice, but rather cranberry supplements to help with the urinary tract infection. And one thing that is not listed here, of course, drinking more water also helps because it allows the bladder to be emptied more frequently and limiting the chance of bacterial growth. Renal failure or kidney failure, there are two types. There's acute and chronic. As the word acute implies, and this is abrupt loss of kidney function. Some of the common reasoning behind that is if you have significant blood loss or dehydration. Kidney stones can also cause acute renal failure. Symptoms, basically either urine production decreases significantly or urine production completely halted. Effects on the body. You can have symptoms like edema because your body is unable to remove extra water. You can have imbalances in terms of your pH, so you can have acidosis. You can have higher levels of metabolic waste building up in your blood as you cannot get rid of them. You can become susceptible to anemia because your body is unable to produce the hormone called erythropoietin that basically responsible for production of blood cells. So EPO is the hormone erythropoietin. If you don't remember what that was, go back to your juxtaglomerular apparatus in part 2 of the urinary system. And in some cases, it could lead to cardiac arrest because of high levels of potassium in the system, as the body is unable to balance ions like sodium and potassium. How do you treat acute renal failure? Typically, best way or long-lasting effect would be a kidney transplant. Now, chronic renal failure, or CRF, as the name implies, it's a progressive, irreversible kidney damage. It typically has three stages where you have diminished renal reserve as the capacity drops to about 75%. Second stage, you have renal insufficiency where the filtration rate starts to drop. And then by the end stages, you will have basically only about 10% of filtration rate, between 10 to 15% of your filtration rate, and 90% of the nephrons are non-functional. Again, what's the treatment for chronic renal failure is still going to be a kidney transplant. Polycystic kidney disease is another one. This is a genetic disease, so you're not going to be born with it. You're not going to basically develop such disease unless you actually have the genetic history or background for it. It is, as the name implies, polycystic. You will receive a very large cyst in the kidneys and the kidney tubules, which leads to cell death. And in typical cases, it leads to end-stage renal failure, which we described in the previous slide. I want you guys to pay close attention to the picture. So on the right-hand side, you will see a normal kidney size, and the opposite, you will see a kidney that is infected with PKD. Again, the size is much higher, much larger, so it can cause symptoms like severe back pain. Again, kind of imagine you have this really large structure in your back, which is going to cause significant shifting in terms of organs. It can cause blood in urine. Again, this kidney that you see in a picture will probably not be functioning properly, which means that the filtration is not done properly, so you will have blood in the urine. Hypertension basically means you have high blood pressure because, again, a lot of times water is being retained in your body as the kidney is failing in terms of water balance. Are these the only symptoms? No, but these are the most common symptoms you will see in PKD. Is there any necessary treatment? Not very much. Again, this is an inherited disease. You can have low salt diet to help with hypertension. You can take drugs for hypertension or pain, but typically it's not treated in terms of taking medications to help cure this. Hemodialysis, or simply put, dialysis for many people. It's when an individual kidneys are failing or have undergone ARF or acute renal failure. Doctors rely on hemodialysis to clean up the blood and act basically as an artificial kidney. These machines also have the capacity to remove the harmful material and at the same time, in many cases, add what your body requires, like bicarbonate, to help balance the pH. Are these machines going to help the person survive for the rest of their life if they have kidney failure? The answer is no. They still require an actual organ to be able to accomplish the task. There's a lot of side effects of hemodialysis if it's repeated over and over, including damage to the blood vessels where the needle is inserted for the process of dialysis. Changes in the urinary system. As the person, of course, increase in age, the activity of the nephron and kidney will decline. Nephrons are decreasing in size and number. Now, the other thing that happens is the renal tubules are not going to be as efficient in terms of both reabsorption and secretion. So what that means is that you are going to basically get rid of things that your body needs because you're not reabsorbing very well. and you're also going to leave the harmful material in your system because your secretion is not effectively taking place. Filtration declines. So again, the rate of filtration or GFR declines, which means that again, things that should be filtered through are not effectively being filtered. Desire to urinate is delayed, which makes you more susceptible to infections like UTI. And then loss of muscle tone in the bladder enables the bladder to hold as much urine, and it becomes harder to hold on to the urine. So that's about it for our urinary system. The last lecture of our unit will be on reproductive system. So keep tuned.